All right. Well, hey, greetings. This is Gabriel A. Timmons Sr. here of GC Financial. I'm the CEO and founder of GC Financial, where we build your future one step at a time. Well, today we're going to go over here understanding affordable health insurance made simple, or what most of us know by ACA. You have a couple other names: Obamacare, marketplace insurance. So we're going to talk about how to make it simple for you. All right. Well, it's good seeing you today on the call. I'm going to go ahead and get started. And thank you for joining here also on this webinar. Overview. Like I said, Gabriel Timmons, life and health and Medicare specialist. We will discuss how the ACA health insurance works, how it affects your taxes. That's important. How it can save you money while giving your family the coverage it needs. What is ACA? Also known as Obamacare, signed in law of 2010. Like I said, there are other names for marketplace insurance. Some people call it Biden care. The goal is to make health insurance more affordable, accessible, and understandable. What I'll say about this is, like I said, came into law in 2010. It doesn't matter whether you're independent, Republican, or a Democrat. This has helped millions of people over the country where they can get insurance at affordable costs. They're like anything, you have the good and bad, but I've seen the impact has helped so many Americans who never had health insurance. I've talked to people all over the country, hundreds of thousands of people that I've been able to help through this process, thousands of people. The key benefits of ACA. Hey, I love this. Covered pre-existing conditions. I've had people that have cancer, illnesses, and they're able to come in the beginning of the next month and get insurance regardless of the medical history. This is powerful, and this really has been one of the major game changers of the affordable care. Offer low cost or no cost plans based on income. So the insurance, the key benefits is that it goes on your household size and your income there, and it also includes essential benefits: doctor visits, prescription drug, ER, and mental health, and no lifetime limit on coverage. Some plans have a lifetime limit on coverage, and what that means is, for example, I've had some insurance, and I do insurance outside of the Affordable Care Act. One of the plans, and most of the plans are underwritten. That's outside of Obamacare. Now, keep in mind, on your job, your insurance is not underwritten, but some coverages on the individual market has what they call a lifetime cap. So that means if I might see a lifetime cap of $3 million or $5 million. So once you reach $5 million, the policy is no good anymore. So a lot of times, some people having cancer treatment, they're hitting a lifetime cap in the very first year. So that's what that means when they say no lifetime limits on coverage. What I just said, caps. How does the marketplace insurance works? You apply through healthcare.gov or a state exchange. We have other states. What they mean by state exchange: Georgia's a state exchange. Virginia, you got Nevada, you got Kentucky, you got several different ones across the country. You have Pennsylvania. So any of the state-based exchanges, you can apply for the Maryland there. Or if it's not a state-based exchange, that means the federal government on the federal level, they're actually in charge of that. So that's what they mean by the state-based exchange. Enter income, the household size, in your location. Now, the next thing you receive a subsidy, or what they call a premium tax credit. That this is important right here about your income, and we'll have an expert from a insurance company that's going to come talk about more about this. But the subsidy is very, very important about your income, making sure you report it to myself or to the marketplace. I tell most of my customers they can just let me know if the income changed, or whether they getting more income, whether they got money from a retirement plan, whether they won the lottery, anything that's reported to IRS. This is important that you make sure you let someone know. Choose a plan: bronze, silver, gold, or platinum. Now, when you're choosing a plan, the one who had the lowest cost copays and doctor visits, it is the silver plan. There, I got customers on the bronze and golds, and actually now under this administration, a lot of my customers will probably be on the bronze plan, or are most likely the bronze plan, because of some things could possibly change going in going into 2026. Now, what is a subsidy? It's a discount that lowers your monthly premium. It's based on your estimated annual income. If estimated too low or too high, you owe money or get a refund. So number three is estimated too low or high, you owe money or get a tax refund. So number three is very, very important. What I said earlier about making sure you let someone know about your income. And this can, when you go into open enrollment that's coming up, the key thing is this is your projected income. So if your income changes throughout the year, doesn't matter what month, just let someone know. Okay. Why people owe money at tax time? Income's higher than expected. Then report any changes. I keep harping that you gotta let someone know. Took too much subsidy in advance. So if your income is lower and you make more money coming up, you make more money later on in that year, you have to report it. So that's like it just says, that's the main reason why you owe too much money. Or you're leaving a job. And a lot of times you're leaving a job and you have money in what they call a qualified account, 403B, 401k. That goes to your income. So just remember that. There you get a lottery, anything that gets what we call a 1099-R that's added to your income, you have to let me know, and that will be added to your premium. Solution: update your income and household information throughout the year. Consider taking in smaller tax credits. Use a conservative income estimate when applying. Work with a licensed agent to stay on track. I'll say that again. Work with a licensed agent to stay on track. One of the things too with healthcare.gov is that when you go directly with healthcare.gov, the thing is that number one is no accountability and you don't deal with the same person. Working on a licensed professional, we have our license on the line. We have to take certification. And I'm pretty sure the people in the marketplace do also, but you can't you don't talk to the same person. If something not right with us being a licensed agent, our license on the line. We get fined. We can lose our license and things like that. Plus, we're professionals. We know we've been battle tested. So it's important that you work with a licensed agent who qualifies: U.S. citizen or a legal resident, not eligible for Medicare or Medicaid. So if you're on Medicare or Medicaid, you're not eligible. The minute you come on Medicaid, you're not eligible. You can't have both. Under the current administration now, if you're on Medicaid and getting the Obamacare insurance, all the money that you're going to be receiving, it will be added on to your tax return there on that. What I mean by that is if you on Medicare and Medicaid and you get an insurance, what happens is if you get a $300 tax credit, whatever money you got during that time or throughout that year, that's 300 times. We'll just say 5 months. That's $1,500 that you're gonna have to necessarily pay back on that. So just remember, whatever change you have to let someone know, and it's based on household size and income, and it's available in all 50 states. Now keep in mind, not all 50 states have. It's going to be on the federal level. Some states you have what they call healthcare exchange when I went in earlier: Georgia, Virginia, Kentucky, Nevada, Pennsylvania. This is just some of the ones off top of the head. So if you're in particular states, what happens is they control the price on your insurance. When to enroll? Open enrollment. It's going to be coming up pretty soon, November 1st to January 15th. A special life change, job loss, birth, divorce, move. And what about move? Remember about when they said move, you're moving out another zip code. Because remember, all the plans are based on the county. So you're in a particular county, and you move it to the next county, that qualifies as special enrollment. There. Now keep in mind, going in with the new administration, you can't change as much as you did in the last couple of years. So just remember, it's going to be some major change in just a moment. I'm going to have an expert that come on and going to kind of maybe hit on some of that stuff. Okay. And we'll be going with some additional stuff after this that I'll be sending out to my customers on some of the changes going up and going to be happening in 2026 too, within the next couple of weeks. As a licensed agent, how can I help you? I can help you apply for the right plan, maximize your subsidy, stay compliant with your tax rules, avoid penalties or a surprise bill, get answers 24/7 on a text only platform there. Real results. Single mom with zero premium. Got several people all over the country that I've helped. Help families save over $6,000 a year, fix IRS debt, incorrect estimate there. So I say that all the time when they go out and deal with people that are not professionals or you don't know which. Make sure you ask the right questions. So I make sure I take my time, ask the right questions there, because you have different scenarios. I have a saying: you can't put a round peg in a square hole. Everybody's situation is different. You're self-employed. I ask questions about self-employed. What's your objective gross income? Hey, are you working on a job and do you have a business? If you're working on a job and you have a business, what happens is the income from your job will most likely you'll save money because you have a business. You're going to have expenses there, so you have to be able to ask the right questions and deal with a professional like myself. Let's get covered. Free help, no cost for my services. So you don't get it. The benefit is by working with a licensed professional, it doesn't cost any money. The insurance carriers are paying us. So, and that's the thing I love about it. You got year-round support. I do our marketing materials. I send messages to my customers. I stay in front of them all year long. You can reach me on my scheduling booking page. You can go to my website there, which is gcfinancialgroupllc.com. That's gcfinancialgroupllc.com. Where you see it here, just take out the book, or you can go to my booking page right there. And then guess what? I love referrals. A lot of my practice is built on referrals. I appreciate my customers. I appreciate you watching the video who's helped me out throughout the years. I've been doing this with affordable care year round. I've helped people all over the country. Even if you need help, and even if you're looking at a plan and you have a job and you have to go on your job insurance, I've taken the time to help customers even there with the best options for them. So whatever question you have, hey, I am here to help you. I am here to serve. I love what I do and I appreciate this. So what I'm gonna do is I'm gonna take a moment and I'm gonna bring on a phenomenal lady. She's helped me throughout the years. She works with an insurance company, just professional, has a heart big as state of Texas. That's one of the things I love about her, but she cares about people there. So I'm gonna bring on just to talk about, maybe talk about changes. Like I have a saying, she's someone that I'm working with there, and we're doing a webinar. I always tell them this main thing. This is like Burger King. You can have it your way. So without further ado, Miss Yolanda, I'm gonna move out of the way and let you take over. But thank you again, and I appreciate you joining me tonight on the webinar.
My pleasure. Good afternoon or good evening, everyone. And I'm hoping that today brought you much happiness, sunshine, and abundance, and you had the opportunity to enjoy some of that. I am Yolanda, and again, I'm excited to be here with you all today to hopefully give you some insight as to what's to come in 2026 regarding your care plans. Now, if you buy insurance through the health insurance marketplace, or you get a subsidy tax credit, you may be getting much less of this financial help that you're receiving in 2025 for the year of 2026 from the government. This could mean a big increase in your monthly insurance costs starting as of January of 2026. Our government has launched a new bill, a new act. It's called One Big Beautiful Bill Act, and it's changing enrollment requirements. It's becoming stricter for everyone. These changes will apply to every insurance company that's across the state of Florida. So it's critical that you have an expert to assist you with your plan comparisons, such as Mr. Timmons there at GC Financial Group. So I tell you, with a expert agent, you can actually have the support that you're in need of to move forward successfully in the 2025 benefit plan period year. So please make sure that you take the opportunity to do that plan comparison with your agent so that you can locate the plan to best fit your needs as well as your family needs at a cost that's affordable for your budget. In most cases, we all, or some cases, everyone that, or most people that are now receiving the subsidy are on that enhanced subsidy that is due to expire at the end of 2025. If that happens, the monthly insurance costs will be much higher for almost all Floridians who buy health insurance through the marketplace or on the marketplace. And some of those costs will be more than double, and they will need to look at a different method or opportunities there at GC Financial to better assist you. So please don't forget to take advantage of that plan comparison. And right now is a good time to start so that you will know exactly as of November 1st what it is that you are interested in or anticipating having effective for you for 2026 benefit plan period. Now, in the changes that are due to come, definitely the enrollment tax credit, or they're requiring for you to have filed taxes for the 2025 tax year. All these things are making a difference. All these things will actually affect that plan and the cost for your plans for 2026. So please make sure that you're doing the comparison because it's out there. Don't let it frighten you because there are opportunities that are still out there. You are as well aware already that you're with an expert there at GC Financial Group. Mr. Timmons is an expert. He's there. He can give you the ins and outs and collaborate with you to find what it will best effectively meet your needs. So definitely do not hesitate. Make that connection and stay with your agent. Communicate with your agent any changes, just as he stated, because if you underestimate that income for that previous year or that year, you'll be responsible for repaying that at 100%. Definitely it's a little less lenient than it is now, but I guess with everything in time, everything has a season. So we are going to be prepared for this. Any questions that you have pertaining to the tax credit, you want to make sure that you ask those up front, or if it's something that comes along during the duration of your benefit plan period year, make sure that you make that contact because without addressing it, sometimes that's when you're left without coverage. Because this year we've seen a lot of the marketplace ending coverage or changing premiums amount without giving notification. And if there's an address change or whatever the change may be, if you've not notified your agent and there are no updates that are made there, then your mail or your contact details are going over to the incorrect location. So therefore, you may have never received the notification that they were requesting additional information. And you go in to receive service and find out that you don't have coverage. So yes, they're coming in and making changes and updating things without you're being aware of it. So it's best to stay abreast of these opportunities of having someone that's working close to you and that can provide you with the details as to what to expect, your next step actions, and getting it, most importantly, taken care of for you. And that is where Mr. Timmons with GC Financial Group comes aboard. So therefore, stay close to your agent. You have some people that may not have notified the marketplace that they filed their 2024 taxes and lost that tax credit. But if that fits you, then just reach out to the marketplace, provide them with the information that they're requesting, and normally they can enroll you back into that plan, the same plan that you previously had if there were not any drastic changes with income or family size or any qualifying events. So take full advantage of knowing that i- nothing is beyond being corrected. So even if this is the situation and you lose that coverage, contact the marketplace, provide them with what they're requesting. And this time of year, it's normally the tax return details from your 2024 tax return. And if you have a family and the children are on the plan, they're going in and attempting to qualify the children for the Medicaid plans. And if that's something that you've not signed up for, or you feel that you don't qualify for, make them aware of that. Make them aware that you did not sign up for that, and they may direct you to contact Medicaid, not Medicare, I'm sorry, it's Medicaid. They may direct you to contact Medicaid, but whatever they direct you to do, please take those steps, make that action to get that completed so that you can notify them. I have the letter. Medicaid is always going to give you a form indicating that the children are no longer on the plan, or they'll give you a letter with a term date or an effective date, or whatever they give you is what you want to provide to the marketplace so that you can move forward with your coverage with the marketplace as you anticipated. But they are requiring documents. It's stricter for 2026, 2025 at this third quarter or the third quarter of the year. This is what we started to be um address with. So therefore, it can take some of your time to get it corrected, and some of the visits may not be covered. So you want to make sure that you stay on top of all this to keep that coverage effective for your entire benefit plan period year. There are opportunities there. Take advantage of again of the opportunities to do the plan comparison. Take advantage of knowing that you have a team there at GC Financial that's going to ensure that you have what you are in need of to move forward effectively for not just if there are any changes that may have happened this year for 2025, but moving forward for 2026 and any year thereafter. So don't let it frighten you. It's just a part of the administration making the changes to fit what their administration plans are. So don't be alarmed by it. Just do whatever it needs to be done for you to be able to move forward and obtain what you're in need of so that you can receive the care that you're in need of. Because most people nowadays, healthcare is a requirement. Um, if it's not at this moment, keep living and it possibly will be 9 times out of 10. So therefore, let's take advantage of getting to know what needs to be done, getting to know what's available for us, and getting to know your agent and could keep that connection and that open line of communication so that if, when, why, whatever changes comes your way, or if any comes your way, or you just may need coverage, that you already have your established relationship with your agent, and knowing that they'll take good care of you sometimes can mean the world of difference. So yes, stay on top of it, stay with it. Don't let the one big bill, one big beautiful bill is what they call it, act. So don't let it scare you. Just let's keep moving forward. Let's stay in contact and do the comparison and find what fits your need. Collaborate with your agent. Find what fits your budget, and let's keep it moving. Let's keep it going. So if you have any questions for me, I would be more than happy to assist with any answers that I could possibly give. And again, I'm just happy to be a part of the podcast so that we can get everyone that needs to be where they need to be, when they need to be, and whatever the reasons why they need to be. So each one helps one. So I've always heard that where there's unity, there's strength. So let's stay in strength with each other and keep it moving.
All right. Thank you very much, Yolanda. I definitely
You're
appreciate it.
welcome.
Thank you. Thank you for the value and the information you provide all the time. You're always willing to help hand Yolanda. So thank you again for joining us. A couple things before we close here. The enhanced tax credit that Yolanda was discussing. It doesn't matter what part of the country, whether you're in a state-based exchange or whether you're on a federal, they will be affected. So I just want to put that out. And here at GC Financial, we have people all over the country. So I just want to let you know I got customers in Florida, several customers in Florida, North Carolina, Georgia, Texas, Oklahoma, all up north there. So we can help you nationwide. I've been doing this. I've been doing the Florida CAC since it got started, but I've been in the insurance, health insurance, Medicare space since early 2010 and 2011. And I also help parents and adults that are on Medicare also. So just want to let you know I am a health insurance and Medicare specialist. So that's what I love about it. I specialize. This is not what I do part time. I seen a lot of things, so I just wanted to share that with you. And the next thing, just remember, you have any questions, you can leave some. I have an email, or you can go onto the website and send me leave your comments there, and I'll get back with you with either a phone call or email. So hey, please like and share this video. If you're watching this on my YouTube channel, please like and subscribe that. So I thank you again for your time here. We'll be sending messages out and also text messages, emails, contacting you to jump on my calendar. So please go ahead and jump on my calendar. You have any friends or loved one who needs an appointment, go ahead and start jumping on my calendar starting November 1st. Keep in mind that I can't make any updates and changes until November 1st. So please don't jump on in October 25th thinking you're gonna get a head start. Please wait until November 1st. I am working on November 1st there, probably until maybe 1 o'clock Eastern Standard Time. I've already got my schedule booked, but I am very flexible. Even on Sunday, I have some appointments I'll be taking even during the open enrollment, which again starts November 1st to January 15th. And this is for health insurance. I do Medicare, but that's totally different. That's Medicare. If you need to think about it for your parents or loved one, you take care. Medicare starts October 15th and that goes to December 7th. I can help you with that also. So, if you have any questions, you see the website, or that's my direct cell phone that's on the screen there. So any questions you might have, anything I can help you with, hey, just remember here at GC Financial, we build your future one step at a time. And thank you again for joining us this evening on this webinar.